I'm Dr. Charles from PHI. If your blood pressure is still high despite taking medication, it is not random. There is a common assumption I'm on treatment, so I should be fine. But in reality, it does not always work that way. Sometimes blood pressure remains high. And when that happens, it is not random. It usually means something in the system is not working as expected. So let's look at the system more closely. Blood pressure control depends on the right medication, the right dose, the right timing, and consistent use. If any part of this changes, even slightly, control is affected. Now let's start with something many people overlook. First, medication changes you may not notice. Sometimes medications are changed without full understanding. It could be a different brand, a different dose, or a medication that has been stopped or added. And this can happen during clinic visits, pharmacy refills, or even hospital admissions. So what you think you are taking may not be exactly what you are taking, and that difference matters. Next, let's talk about consistency. Blood pressure medication only works when taken consistently. Missing doses, taking it at different times, or stopping when you feel better can all affect control. What this leads to is unstable blood pressure, reduced protection, and an increased risk of complications. Because the pattern is simple. When use is inconsistent, blood pressure fluctuates and risk increases. Another important issue is understanding the prescription itself. Many patients take medication without fully understanding what each drug is for, when to take it, and how long to take it. As a result, errors happen. Wrong timing, wrong combinations, or missed doses. And when that happens, the system breaks down. Now, your body often gives clues when something is not right. So it is important to recognize the warning signs. Watch for blood pressure staying high despite medication, new or worsening headaches, dizziness, blurred vision, chest discomfort, or even more subtle signs. You feel different after a refill. Your tablets look different. Your routine has changed. These are signals to check, not to ignore. So what should you do? Do not guess. Instead, verify. Make it a habit to know the names of your medications, confirm your doses, and take them at the same time every day. At the pharmacy, check if your medication has changed and ask questions if the tablets look different. At the clinic, bring your medications with you and review them with your doctor or nurse. Because when there is clarity, there is correct use, and that leads to better control. If you step back and look at the pattern, a clearer picture emerges. When blood pressure is not controlled, it is rarely just one issue. It is usually a combination of medication changes, inconsistent use, and lack of clarity, all affecting the same system. Final point: high blood pressure that is not improving is not something to ignore. It is a signal, not just to increase medication, but to check the system. Because when the system is clear and consistent, control improves. Finally, know when to act. If your blood pressure remains high or you notice unusual symptoms, do not wait. Speak to your healthcare provider, ask questions, confirm your medications, or call or WhatsApp